You know that twice-a-year ritual of changing our clocks? Yeah, it always feels like a slightly annoying tradition, but what if it's costing us more than just an hour of sleep? A brand new study reveals a staggering connection between our time policy and our health. And honestly, the findings are pretty shocking.
Okay, so let's just dive right into the most startling finding from this study. It suggests that the simple act of switching our clocks back and forth year after year has a direct and, frankly, massive impact on public health.
I mean, you know, that groggy, out-of-sorts feeling, right? Well, you're not imagining it. That's your body literally struggling to adapt. But what this new research is showing is that our collective struggle is adding up to something way, way more serious than just being a little tired.
Okay, get ready for this number. This isn't some tiny statistical blip. A new model suggests that just by picking one time and sticking to it year-round, the United States could prevent this many strokes every single year. Over 300,000. And that is not all.
Nope, it's not just strokes. The very same model connects our current time policy to an incredible 2.6 million cases of obesity annually. You know, when you start seeing numbers this big, the conversation really has to shift from a simple inconvenience to a major public health crisis. So what on earth is going on here?
To really get how changing the time can have such a dramatic effect, we need to talk about a system that's built into, well, every single cell in your body, your internal clock.
And that system is your circadian rhythm. Think of it like your body's master pacemaker. It's a roughly 24-hour cycle that is super sensitive to light. And it doesn't just manage your sleep, it coordinates the function of basically everything, from your metabolism all the way to your immune response.
So what happens when we force our daily schedule to be out of sync with that natural internal clock? Well, we create what scientists call circadian burden. It's essentially a form of chronic stress on the body, and this right here is where all the health problems start.
Study co-author Jamie Zeiser puts it in a pretty stark way. He says for any one person, the risk from a single clock change is tiny, kind of like the odds of winning the lottery. But when you force 350 million people to play that same lottery all at the same time, someone is going to lose, and lose badly.
So, if our current system is causing all this stress, what are the alternatives? Well, the researchers modeled 3 different scenarios to figure out which policy puts the least amount of that circadian burden on all of our bodies. All right, so here are the 3 options on the table. First, there's our current system, switching back and forth twice a year. The second option is moving to permanent daylight saving time, which would give us more light in the evening during the winter. And the third is permanent standard time, which better aligns sunrise with our morning schedules. Okay, so which policy actually came out on top? This table shows how many health cases could be prevented each year compared to what we're doing now. And while sure, permanent daylight saving time is a huge improvement, the winner is obvious. Permanent standard time would prevent nearly 900,000 more cases of obesity and over 85,000 more strokes than permanent DST. The data really just points to one much, much healthier option. So you might be wondering, how in the world did these researchers come up with such specific, astonishing figures? Let's take a quick peek at how their model actually worked. This was a massive undertaking. The team ran a huge simulation. They calculated the light exposure and the resulting circadian burden for people in every single county in the U.S. over a full year. And they did this for all 3 time policies, assuming a regular 10 p.m. to 7 a.m. sleep schedule and a typical 9 to 5 workday.
Now, of course, no study is perfect, and the authors are really transparent about the limitations here. Their model used some pretty ideal assumptions about sleep and work, and it had to rely on self-reported health data. It also didn't account for every variable out there. Now, these factors don't really invalidate the core findings, but they're definitely important context to keep in mind.
So, after running all those simulations and crunching all that data, what's the final verdict from this research? What's the healthiest way for us, as a country, to set our clocks?
The conclusion from this model, at least, is unambiguous. Adopting permanent standard time year-round is the single best option for the health of the nation. But why? Why is that one so much better?
Well, it all comes back to this. Permanent standard time creates the smallest possible gap between our internal biological clock and the external social clock that we all have to live by. This means our bodies are just more naturally aligned with the sun, which leads to the lowest possible circadian burden. It is, quite simply, the time our bodies were designed to live on.
So the science seems to be getting clearer and clearer, and the potential public health benefits are just enormous. This research really forces us to ask a very direct question. If we could prevent hundreds of thousands of serious medical conditions every single year with a simple policy change, why is this still even up for debate?